So, until now, we have seen how substances get exchanged at the level of tissues between blood in capillaries and the interstitial fluid. And we also got a brief concept of edema. That when due to any reason this interstitial fluid gets accumulated, it causes edema. That can lead to severe problems. So, to prevent this edema, and to keep the balance between the filtration and reabsorption of the fluid, the lymphatic system play its role, as lymphatics return excess interstitial fluid to the blood. To understand it better, let's learn basic introduction of the lymphatic system. Like the vascular system, the lymphatic system is also a network of tubes extended throughout the body. But these tubes are comparatively more delicate than the blood vessels. Along with many other functions, the main role of lymphatic vessels, or simply lymphatics, is to drain fluid from the tissues back to the bloodstream. That drained fluid is actually the one that has been filtered by the capillary exchange. And it has been estimated that almost 20 litres of fluid is filtered per day at the arteriolar end of their capillaries. And out of that 20 litres, almost 16 to 18 litres is reabsorbed at the venular end. Now the left amount of fluid, which is around 2 to 4 litres per day, is an estimated amount of fluid that needs to get back to blood, so it finds its way through lymphatics. Lymphatics arise in the interstitium as small, thin-walled channels of endothelial cells that then join together to form increasingly larger vessels. These initial lymphatics are also called terminal lymphatic or lymphatic capillaries, as they are similar to blood capillaries, but the difference is that they have many interendothelial junctions that behave like one-way microvalves. These microvalves are also called primary lymph valves. These initial lymphatics then continue, and some anchoring filaments connect them to surrounding connective tissues, giving rise to larger collecting lymphatics. These collecting lymphatics are similar to those of small veins. The large lymphatic vessels, like the veins, have secondary lymph valves that restrict the backward movement of lymph. Two phases exist here. One is the expansion phase, and the other one is the compression phase. During the expansion phase, although interendothelial junctions seems tightly closed due to endothelial overlapping, but the pressure gradient from the interstitial fluid to the lymphatic lumen deforms the endothelial cells, so that the microvalves open and fluid enters the initial lymphatic during the expansion phase. But during this phase, secondary lymph valves are still closed. This happens because during the expansion phase, hydrostatic pressure in the interstitium is more, or it exceeds the hydrostatic pressure in initial lymphatics, causing microvalves to open and fluid to enter the lymphatics. Once the fluid enters the lymphatics, now it is called lymph, and there is no pump that forces this lymph to move toward veins. But it either complies with the arteriolar pulse, and also the force of contraction by skeletal muscle. This contraction initiates its compression phase. During this compression phase, external pressure from skeletal muscle or any other source causes microvalves to shut, and lymph fluid enters the larger lymphatics through the opened secondary lymph valves. These valves open in one direction only, preventing the backflow of lymph. So, this was generally about flow through lymphatics. Along the path of collecting lymphatics, there are larger lymph nodes. Lymph nodes are actually the filters that clears up lymph of any waste or bacteria. There are a total of 700 lymph nodes found at different points in the body, including the throat, chest, armpits, groin, and abdomen. So overall, we conclude it as lymphatic vessels lie in close proximity with the capillaries, And during microcirculation, when 20 litres fluid is filtered, but only 16 litres get back in. Then remaining 4 litres is absorbed by the lymphatic capillaries through the expansion and compression phase, as we have just seen. Lymph then enters the large collecting vessels. Along their path, there are lymph nodes. Lymph nodes have a wide range of functions, but generally they are associated with immune defense. Bacteria or other foreign products are picked up by macrophages when passed through these lymph nodes. A large number of lymphocytes present there, attack, and kill those bacteria. Once lymph gets cleaned up, it drains into the thoracic duct majorly, and from there it enters the left and right subclavian veins. Through that subclavian vein, it merges into the superior vena cava, and thus enters the heart again, becoming part of deoxygenated blood. And we know how deoxygenated blood again enters systemic circulation after getting oxygen from the lungs. And so the cycle continues. So, we'd have seen these lymphatics play a very important role in drainage of excessive interstitial fluid back to the heart, thus preventing the accumulation of fluid in interstitial space. So, this was all about today's lecture, where we have learned about the detailed anatomy and physiology of microcirculation, and later we learned about the role of lymphatics associated with microcirculation.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.